31st day of October 2017 finds us discussing cancer, especially the way forward. How do we move on? This entire month, right here on Good Morning Kenya, we've been focusing on issues related to cancer, and we've profiled various types of cancer based on their prevalence in the country currently. But now, after having those kind of conversations, it's very important that right about now, we have a conversation around how do we move forward? What are the gains so far? What are the areas for discussion and further for growth? What do we do as a nation to make sure that we're able to fight this particular battle and win it collectively together as a nation? I've got a panel of three with me in studio, and I will introduce them, beginning with my immediate right. I have Florence Ojode, a cancer warrior. Welcome to the program.
Thank you.
It's such a pleasure. In the middle, I've got David Makumi from the Kenya Network of Cancer Organizations. Karibu sana.
Asante sana.
And straight ahead, I've got Dr. Alice Musibi, an oncologist. How are you?
Good.
Karibu sana. I would like to begin with you, David, because this has been a Breast Cancer Awareness Month, but in the country we use it as a month to discuss issues related to cancer. Where are we as a nation? What do we need to be reflecting upon at such a time?
Yeah, it's been a very eventful month. I mean, Cancer Month is always eventful with a lot of awareness, education, and of course, programs like this that educate Kenyans. But limiting cancer to just the Breast Cancer Awareness Month is not good enough. Fortunately, just about 2 months ago, the country launched the National Cancer Control Strategy, which is the blueprint of how we shall deal with cancer for the next 5 years. And I think what is important is to keep the campaign sustained so that the wananchi do not think about cancer only during October. You know, we actually used to run a campaign saying, don't wait for October. We need to make sure that in the midst of all the political noise we are hearing, that the cancer still remains relevant as an important agenda. We, from statistics, so we lose almost 70 people every day to cancer and nearly 40,000 new cases. That's a huge number. So cancer is not going to go anywhere after this month. So reflecting on the gains we have made in terms of awareness, you said most of the awareness is happening in urban areas. There's still a lot of work to be done in the counties. Hopefully as the new county governments take charge of health programs, most of them have new executives or new ministers in the counties. They need to prioritize cancer for their areas.
Yeah. For their areas. Dr. Alice, when you talk of losing 70 people to cancer every day, it begs the question, what are the medical and professional needs that the country requires to scale this number down and eventually eliminate it totally?
Thank you. The first actually goes back to what David is talking about. Awareness, right from top to bottom, from the public itself, because they have to know what we talk about when we say cancer, considering it does not just present itself and say, oh, I am here. It is a confusing disease which actually presents in all manner of things. Many people will say it's malaria for long. Many people will say it's back pain for long, whereas actually what is hiding there is cancer. So public awareness has to be done and done well. Because the same awareness actually will help people get to know that they're having cancer, meaning it will be diagnosed early, and this translates down the line to better outcomes. Now, the second one is for health professionals to also know what cancer is. When I say that, you'll wonder, then how come they are health professionals?
Exactly.
But when we go through our various schools, whether it is nursing, clinical officers, or the medical school, cancer is not one of those things that have been quite emphasized. We'll talk about TB, we'll talk about malaria, or in short, we'll talk about infectious diseases. But cancer is at another level, what we call a subspecialty kind of subject. So it is not actually dealt with in detail as we'll do something like pneumonia or tuberculosis. So we have to come back in the training of all those health professionals to actually emphasize on what else will cause diarrhea other than typhoid, because it could be colon cancer. So when that is done throughout the spectrum of health professionals, again, we'll improve the diagnosis and pick-up rates. Now, at the same time, we're starting from below, but we also have to go on the higher level to have specialists who, if the people from the ground are actually detected and diagnosed, who actually takes care of them, because it requires a subspecialty. You become a doctor, you become a physician, and then you become a medical oncologist. That's the path that I've taken,
Yes.
and a few of my colleagues, and there are not many, considering the population that we have in this country. So it is also training from above.
Right.
It requires a lot of input from the government because it's expensive, but luckily we have a fellowship now, but we need more people getting trained. We have to interest the same colleagues to actually train for medical oncologists. How? Resources, equipment, and facilities, because you'll train and I can't practice. So right now we only have one public cancer treatment center, that is KNH. It is doing all it can. I work there and I know,
Yes.
but literally it's not enough. So
Right.
like David said, we are now in the counties. Where else can we expand so that we actually also get to use it to put up further facilities?
Right.
That way we can maybe manage.
Thank you. Thank you. Florence, coming
Yes.
to you. Welcome to the program.
Thank you.
Just tell us your story on as far as your battle with cancer is concerned.
Yes. I first got cancer July 2007. Before I was diagnosed with cancer, I had just lost my younger sister to cancer. She was laid a month before I was diagnosed. It was a bitter pill for the family because we are still mourning. So when I got cancer, I was shocked. I thought I would go through what my sister went through. I took her to India for treatment and I was very well. We were there for 4 months and in a cancer hospital, and I was very well. So I learned a lot about cancer, self-examination, how to deal with cancer patients. So when I got it just a month after we laid my sister to rest, it was not an easy thing. I went to the bathroom and I was doing self-examination as I was taught in India, and I felt a lump on my right breast. It was a small lump. I kept on praying that the lump would go away. It didn't. Then immediately I consulted a surgeon. The surgeon took me through tests, FNA, biopsy, and it was found to be cancer. So I was booked in the hospital. I went through mastectomy. After that, I went through 6 sessions of chemotherapy, which is not an easy treatment. And I got cancer at an advanced age. I was 60 when I got cancer, but I managed. After that, I went through 25 sessions of radiotherapy. And I was well for about 2 years. I was on hormonal treatment. Come 2010, as I was still examining myself, I noticed the tip of my breast, the left-hand side, was inverting inside, which is not a good sign. It means there's something pulling it inside. So I again went to my oncologist, who took me for tests. I went through biopsy and they found it was cancer. So again, I went through mastectomy, but this time I didn't go through chemo because it was an early stage, but I went through radiotherapy, 25 sessions. And then after that, I was well. Come 2012, I started feeling sick. I couldn't sleep at night, I couldn't eat, I was nauseated, feeling bloated. So I went to the doctor. The doctor said this could be acid. I was put on acidity tablets for 2 months. It didn't improve. Then my oncologist said, now we have to scan the whole body. As I went through the scan, they found I have a big lump on my pelvis. So the doctor said I have to go through surgery, and then they'll examine the tumor to find out what it was. But then my family said, since I have had 2 cancers, this is now the 3rd one, they better take me outside the country. So I went to Israel. In Israel, they have PET scan. When I was put through the PET scan, they found it was cancer. So again, I went through a very major operation, and they removed the tumor, and the doctors in Israel said it was an early stage, so I didn't go through chemo or radio. But I was put on hormonal treatment. I'm still on hormonal treatment. That was I went to Israel 2012, I came back 2013. After that, I've not got recurrence again, but I keep on going for tests in case something comes back and it's rearrested early. But cancer is not an easy disease, but it is not a death sentence. I didn't know that I would still be alive after 10 years and celebrate my 70th birthday. When I got it when I was 60, I thought probably 1-2 years I'll be dead. But if you have cancer, you have to be strong. You have to fight it. You have to live a normal life. You have to go and talk to people. You don't have to hide the disease, because if you hide the disease, you will be frustrated. Like sometimes when we go to support group, some people don't even want to talk about it. They even said even their children don't know they have cancer. I think you have to talk about cancer. I've been going to the slums to talk to women about cancer, and the problem they have, it's money. When you go and find a woman with a lump, they'll tell you, now if I go to hospital, where will I get money for operation, chemo, or radio? So I think the government should come up with a hospital where patients with cancer can just walk in, they are treated without paying anything. Because cancer does not attack only rich people, it attacks everybody. And not everybody has money. Even if you have money, cancer is very expensive. In fact, it brings poverty in the family. So the government should actually assist us.
Great. But I'd like to come to Dr. before I come to you, David. And the question to you, Dr., that I've even been getting on my social media platforms, people need to understand what exactly causes cancer. That is one concern they have. And number 2, what would make it recur?
If somebody tells you they know what causes cancer, I think they will be lying.
Uh-huh.
So that includes me.
Okay.
So what we know is there are factors, internal within the body, external, that actually increase the risk of anybody getting cancer. People are totally different. They have been genetically made different, but what actually triggers this person to get cancer and not the other one, that's within the body. However, there are things that are known. If you get exposed much more than the other person, it increases your chances of getting some particular kind of cancers. We know about smoking with lung cancer. We know about some infections, HIV, human papilloma virus associated with cervical cancer. We also know there's some genetic genes, BRCA1, BRCA2, that also might predispose you to get breast cancer. We go back to Florence with her sister and herself, okay? It is not the usual pattern of cancer. So we might want eventually to look at her tree, family tree. Are they predisposed to this particular gene, to explain why two very close members of the family should actually get cancer? So in short, we do not know anything specifically that causes cancer. We know about risk factors that predispose or increase the chances of anybody getting cancer. And that is why we talk about prevention and the screening, because screening will help. Like now, Florence's family, they should go for screening. The daughters that are in the family, the other ladies that are in the family, the men that are there, because they could also be predisposed to things like colon cancer or prostate cancer. So the prevention is stop smoking, reduce your alcohol intake, go for physical activity. So also it reduces the exposure of those particular risk factors.
David, what are the gains so far?
In terms of cancer in our country, I think one of the important gains is even having programs like this dedicated to cancer, and what KBC and Good Morning Kenya are doing about keeping the agenda alive. The fact that there's a lot of interest from the media, from the print, from the electronic media, and even in the social media, there's a lot of interest about cancer.
Yes. And
the fact that we have people like Florence here coming to say that I was treated for cancer, not once, not twice, 3 times. So the fact that there's a lot of public interest in cancer. We are not exactly where we should be, but the fact that people are curious to know what causes cancer, what can I do to protect myself, where can I go for screening. And I think to some extent, there's a bit of political will, with the powers that be at political level, in terms of the fact that there's a lot of public interest and media interest has pushed the ministry, to start doing a few things. One of them, of course, is the enactment of the National Cancer Control and Prevention Act 2012. It was signed nearly 5 years ago. The fact that there's a National Cancer Institute that desperately needs good money. The government just needs to put serious money to get this institute, getting experts and putting in place structures. But it is there. It may be broke, but it is there. And the other thing that also is happening with the devolution, there are some counties that actually, I would say, are more cancer-friendly in terms of trying to look at programs that they can implement. Not all of them. Every county has its own priorities, but certainly there is that element of people wanting to start cancer programs within their counties. I mean, this has to be done in a coordinated way, and one of the things that the ministry has actually done is to come up with a guidelines for establishment of cancer treatment centers. Because again, we want Kenyans to get the best in terms of quality. We don't want everyone opening a little something at the corner of the street and calling it a cancer center.
Yes.
The ministry is coming up with those sort of guidelines. We also have a national cancer treatment guidelines. So some of these documents, you know, as Kenyans, you know, we are very good with documents. We are very good in going to, with going to Naivasha and coming up with very serious documents. After a week of, you know, eating well at Naivasha, we still come up with documents.
Yes.
The trouble is implementation. That's where the problem is. And the implementation, I think, is an element of, there's an element of financing. Because, you know, we just need to implement these things. We need to finance, to put good money into it. And the other gain I would say is the incorporation of palliative care in all the major county referral hospitals. So palliative care has actually taken the lead in terms of empowering health workers and ensuring availability of essential medications. We are not there yet, but there's a lot of work that has been, good work, that has been done in palliative care, and the fact that Kenyans are able to demand for screening. But I think the drawback, as I pointed earlier, is that we only wait for 1 month and we are all over going for screening. And even health facilities offering discounted rates for screening only in October. It's not good enough. If they can do it in October, they can also, you know, just slash the prices throughout the year so that Kenyans can access more. But we also have a lot of challenges. Tobacco industry.
Yes.
You know, no matter how much we try to fight, you know, now we have the pictures, graphic images on tobacco packaging, and they will still figure another way of pushing tobacco through shisha. You know, the posh kind of sophisticated way of consuming tobacco, shisha, especially for the young people, young ladies and young men all over in high-end places, you know, doing the shisha thingy. So that's an area that we are not there yet with the tobacco. But the other area that we, as a country, somehow want to keep, we don't want to ruffle feathers or step on toes is the alcohol industry. I mean, if you look at all the adverts around alcohol, yes. Whether it's billboards, whether it's a bottle, the retro print about excessive use of alcohol consumption is harmful to you. Is a small one. And, you know, they've been talk of, we need to have that more explicit so that people know, and a little more explicit. Just saying excessive, it's not good enough. So we need to actually take the alcohol industry head on, because alcohol is one of the risk factors. Dr. just mentioned that, but not just for one cancer, for a number of cancers. You know, oral cancer, colon cancer, you know, cancers of the mouth, gums, and so on. So we need to take this industry head on. There is no health benefit to use of alcohol, and with the, you know, in cancer and alcohol, it's not the type of alcohol, because the ingredient, which is ethanol, is the harmful component. So whether it is kumi or whether it is expensive spirits or wines, it's the same thing. So we need to look at that. The other, of course, the fast food industry. Dr. just mentioned about issues around nutrition and also exercise. And so refined sugars, all this junk food, the junk food that, you know, we think as a country, because we have big multinationals setting shop here, with the junk food and all that we are doing well, you know, and we have disposable income. So if your child knows which are the biggest burgers and does not know how to pronounce murenda, cannot pronounce terere, then we have a problem.
Sure.
Yeah, so these are things that we need to start addressing in terms of not just protecting ourselves from cancer, but also non-communicable diseases. These days we are approaching a lot of these things together with the non-communicable diseases, you know, diabetes, hypertension, and all that. We need to address our industries. You know, when we look at environmental pollution, exposure to harmful chemicals in industries, especially the paint industry, exposure to things like benzene and so on, the NEMA needs to address that not just as an environmental issue, but we also need to address it as a public health issue, protecting our workers in industry from all these harmful fumes. You know, it's okay to picket for salaries, increase in salaries, but it doesn't help you if you don't have the right masks, the right gloves, the right gumboots, and all the things that you need to protect you if you're working in a petrochemical industry and so on.
Florence, when you received the news that you have cancer, and throughout the treatment, 10 years down the line, how did you readjust your life? What did you start doing that you weren't doing, or what were you doing that you stopped doing?
At first, I was not interested in doing exercises, but these days I do a lot of exercise. I walk, I go for exercises at Mpisha about twice or once a week, and I make sure I am active. But cancer has not put me down. It has not stopped me from doing anything. I go out, like now I've just come back from US. I was there for 3 months on holidays. So cancer has not put me down. And I live a normal life.
A normal life?
Yes.
You said that you interact with other people, even in the slum areas, in a bid to highlight or give awareness about cancer.
Yes.
Other than resources, because you said money is a problem,
yes,
what other issues are prevalent that need to be addressed?
I think they need counselors because they are very scared of cancer. Once they hear cancer, they see a death sentence. I think they have seen many people dying of cancer there, but most of it, I think, is because of lack of proper treatment. So when they hear cancer, you can find a woman with a lump, and she's so scared to go to hospital until the lump bursts, and then it becomes very painful.
Counseling?
Yeah, I think they need a lot of counselors.
Psychosocial support?
Yeah.
Daktari, two questions for you. The first, to family, friends, the support system, what kind of care should be given to a cancer patient back at home? What should they consider?
Cancer management has what we call multidisciplinary teams, which start all the way from the professionals and all the way down to the counselors that Florence is talking about, palliative care. At the level of that whole line, we try as much as possible to also incorporate the family, so that they know what actually is this patient going to go through, what is expected, and eventually what is their role at home. Well, Florence might wink on that because more often than not, it depends on where your care is being done. In places like KNH, it's other than now that they have gotten a network for taking through patients through the nitty-gritty of the treatment. Before that, because of numbers, we were not able to go through that planning. But yeah, these days we have navigation, yes, which is working very well. Because the patient, the doctor, when I sit with the patient, I won't have, honestly, I won't have that time to take them through the whole line. But the patient and the relatives need to know what cancer they have. They need to know what stage they have. They need to know what treatments they are going to go through, surgery, chemotherapy, radiotherapy, because unfortunately in this country, we get our cancers a bit late, where all this combination of treatments have to be given. So they need to know all that, and they need to know the side effects or the outcomes of all these treatments. Now, chemotherapy is one of the worst of these treatments because these are systemic things. They are drugs that we give. They have all sides of side effects, nausea, vomiting, lack of appetite. And if these are actually affecting the patient themselves, the chemo sometimes also gets delayed, gets postponed, and the outcome also is not good.
Yes.
So at home, the relatives ideally gets cancelled. What do they do when the patient is having so much vomiting?
Right.
What is extra? is there diet changes or anything like that? So they need to know.
Great.
So we tend to leave that sometimes to the navigators or to the counselors and the palliative care team to take through.
I'm actually very glad that you've talked about navigation because I was headed there. And we have barely 5 minutes to wind up the interview, but not before we tackle the critical question, which is actually on your screens right now. Moving forward. How do we move forward? Very quick ones from each and every one of you. I'd like to begin with Florence, then David, then Tumalizia na Daktari.
Moving forward.
From where we are right now, what needs to be done to win the battle against cancer?
I think a lot of awareness. Yeah. You know, awareness is done only in the cities, towns, but not up country. Up country, people don't even, some people don't know about cancer. When they have a lump, they think probably it's a boil, and they start using herbs, thinking it will go, and it doesn't go. So I think awareness
It's very critical.
is very critical.
Over to you, David.
Yeah. I think we have laid the foundation with all the relevant documents and strategies and policies. It is time for action. We really just need to implement what we already have, and not just at national level, at county level, down to the grassroots. The Kenya Network of Cancer Organizations, with the nearly 30 cancer organizations, is doing what it can. We are not funded by government. Most of us are volunteers and looking for support here and there. But the government needs to put money in cancer, in the National Cancer Institute, but also working closely with the Cancer Civil Society to implement a lot of the programs that our member organizations at KENCO have, but they don't have the resources to do that. So we are partners, but the counties also need to prioritize cancer. There is no way we are going to implement cancer from just at national level. It has to be owned from the grassroots. And the last thing is every Kenyan, every single Kenyan in the streets has the responsibility also for cancer control. You don't need to be an expert to tell people that tobacco will kill them, smoking will kill them. A lot of things we can do for ourselves. You can exercise. You don't need to enroll in a gym. You can walk, avoid doing the boda thing, and just walk, you know, because we are all hell-bent on taking Nduthi to the next destination.
Yes.
So there are many things we can do for ourselves instead of sitting. We will have the fancy, sophisticated machines. That's important. But there will be, having the machine and drinking ourselves and eating ourselves to the grave is not going to help us.
Yes.
Yeah.
Sure, coming to you, Dr.
I might say too much, but two things.
Yes.
One is to actually overemphasize what David had said. We have to jumpstart and enable the National Cancer Institute do what it was mandated to do. We made the program, I mean the charter of that institute, but I think right now it is just somewhere. So we may not literally go and pretend that anything on cancer might actually hold unless that one is working.
Right.
The second one is each and every one now has to be on the National Health NHIF, because yes, for now it is helping quite a bit, but to the NHIF as well, they also need to consult the experts on what really is required as far as cancer is concerned. Because cancer is not one disease. Florence breast cancer is totally different from Aunt's breast cancer, and the treatments are totally different. So even when it comes to facilitating their treatment, it has to be in conjunction with the experts.
Right.
So they are doing quite a bit right now, and we are appreciative as the practitioners in oncology. But I think there needs to be a bit more lineups of what really should benefit the patients much more.
Right. Thank you all for coming. David, it's always a pleasure. Dr. Alice, it was a pleasure meeting you, and thank you for sharing your insight. Florence, your story is inspirational. Keep doing what you're doing. It's helping out so many people out there. So keep at it. And indeed, we shall all be at a position of making a difference. We've been discussing cancer this entire month, but it doesn't stop with the 31st of October. It's a conversation that will continue right here on Health Tuesday and on various other platforms, so that together as a nation, we're able to fight and win the battle against cancer. Losing 70 people per day to this, no, we can't. We just can't as a nation. We need to move forward and eradicate this. My name is Samuel Njoroge. Have a blessed day. It's been a pleasure. On behalf of the entire production crew, we say God bless you all abundantly.